well aware that there is many things to be offered. It's not.
We have a caller on hold. Spencer has been waiting patiently to ask us a question. Spencer, you are live with Docs on Call. What's your question?
I just wanted to know how long it's going to last for this tonsillectomy to stop hurting.
If you know, pain has different components. We break it down into nociceptive and neuropathic pain. The nociceptive pain that you may be experiencing, if this is an initial onset, is usually the kind of pain that most people have right after surgery. And that often goes away. When pain stays longer than that initial stimulus, then it develops a neuropathic, a nerve component. The nociceptive pain usually improves over the week or two after surgery. If it persists beyond that, then you have to kind of consider some of the other reasons for that ongoing pain, which may be an ongoing infection or different things going on in that region. But oftentimes pain gets better rather quickly after surgery, and taking anti-inflammatories and other pain medications tends to help quite a bit.
Very good. Now let's get to Tim's question. Tim is on the line. What's your question? You're with Docs on Call. Go ahead, Tim. Are you there with us, Tim? I think we may have lost that caller. We apologize for that. We've got a couple of other questions here. Nancy says she was diagnosed years ago with a loose disc and now has swollen ankles and knees, and also has lower back pain. Could this be from the loose disc years ago? She's got no insurance and wonders what she should do. What would you say?
Well, I think the first step with any question is evaluation by your primary care physician. Usually swelling of the knees and ankles oftentimes relates more to a vascular or a venous problem of the lower extremities, or even a lymphedema problem of the lower extremities. It is unusual for swelling of the limbs to be associated with pathology present in the spine region. Therefore, I would start with the primary care evaluation for evaluation of the swelling. Now, it is very likely, or could be likely, that the quote-unquote loose disc that she experienced many years ago could be related to the development of her low back pain that she's having now. However, I do think that would be more likely a separate etiology than the lower extremity swelling that she's experiencing.
And of course, we're going to hear this probably from time to time from folks who don't have insurance or are underinsured for their medical needs. What is your suggestion in that case of how they can maybe reduce some of their pains, lead a healthier lifestyle, but certainly not avoiding going to the doctor's office completely just because they don't have insurance?
Correct. I think everyone speaks about lumbar health or spine health, and it's very straightforward if you think about your options. Number one is keeping your weight under control. The vast majority of patients that we see are obese, and medical research indicates to us that obesity over a lifetime increases stress across the lumbar spine, increases early degeneration. Also, cigarette smoking, tobacco usage. Tobacco affects the microvasculature of the spine, decreases blood flow to the spine, may also lead to early degeneration. Also, increasing your activity, it improves the health of your muscles, your joints, your ligaments. All these things can be helpful in preventing lumbar disc disease or low back pain.
And sometimes that can feel hard to do, though, because they're already worn out or in pain, and getting moving again seems like a very tough thing to do.
Absolutely. One thing that I truly think helps patients quite a bit is aquatic therapy. I encourage many people, if they have access to pool, and not everyone does, but access to some type of pool where the water creates more buoyancy, may make the patient more comfortable in the water, and they're able to perform more exercises in the water. I think it's a good place to start if available.
Let's talk some about fibromyalgia. It's a popular topic nowadays. We've got a lot of people who are finding out they are diagnosed. We're actually going to get back to that conversation in just a moment because we've got a caller on hold and I don't want to keep her waiting too long. Linda is on the phone and she has a question for us. Linda, you're live with Docs on Call. What's your question?
That's just what I was going to talk about is the fibromyalgia. I have it very bad.
Linda, how were you diagnosed with fibromyalgia?
I have it basically all over my body.
Were you evaluated by a primary care doctor for all the different tender points and different parts of it, or?
Yes.
Okay. And what have you done to this point in regards to treatment? What have you done so far, treatment-wise?
Basically, water, been in the water, and like that, I'm very, I'm very obese.
Okay. One thing I can recommend to you is I think good sleep habits are very important in fibromyalgia, and it's sometimes overlooked. If you're not sleeping well at night, I can tell you that your ability to deal with that pain in the morning when you get up is going to be markedly diminished. So making sure that you have good sleep architecture is extremely important. And there's, besides medications, there are numerous medications, most of which are not habit forming, that can be implemented. Sleep is extremely important, and then exercise and stretching is also extremely important for fibromyalgia. Focusing on exercises that are mostly low impact, high resistance. Aquatic therapy is excellent. You know, those bands, those are very good as well. And then even going to physical therapists to get a home exercise regimen that you can do daily is extremely helpful as well.
So don't be afraid to reach out to someone for help in something as simple as exercise, and what you do at home can be something very simple like stretching.
Yes.
It's a good starting point anyway.
Excellent start.
Sharon is also on the phone. She has a call for us. Sharon, you're live with Docs on Call. What's your question?
Hello.
Hi, Sharon.
Hello.
Hello.
Hello, can you hear us?
Hi. I have a problem with my sacroiliac joint. And I've had physical therapy, and I've had injections. I've been to chiropractic, and the physical therapy the last time's been like a little over a year, and I've been doing good with the exercises. But now it's flared up again, and I'm in a lot of pain. And I just wondered if there's something new for that.
Well, actually, now that you mentioned it, we are actually trialing a system at our pain clinic that is very new, and that shows a lot of promise. It's in the realm of radio frequency, but it's more complete than the usual way radio frequency is performed. And I've had some pretty good success with it before I came here, and even now, I think quite a bit of it. So there is more. I suspect that the kind of injection you've had in the past has been a steroid injection into that joint, and oftentimes I use that for a diagnostic block. So the pain relief from that is usually not sustained. But if you experience a positive response to that block, we can offer you some things in the way that could be much more sustained. And then obviously, once we can achieve some level of pain relief, making you more functional would be the goal. And then obviously evaluating for structural things, hip symmetry. So
chiropractic is probably a good idea still with something like that?
It can be helpful. Physical therapy is obviously good. Looking at your posture, things like that can be very helpful as well, and sometimes underdiagnosed.
Okay. Bill has a question for us. Bill is on the phone. You're live with Docs on Call. What's your question, Bill?
Yes, ma'am. I've got 2 vertebrae out of place. What would it take to get them back in place?
Bill, would you say that the vast majority of your pain is located in the low back, or do you have more pain in the lower extremities, in your thighs and legs?
My knees and ankles cause me severe pain. My lower back, knees and ankles.
Okay. You know, I basically look at lumbar spine pathology in 2 ways. We see degeneration of the discs or arthritis of the spine, and that is often the culprit behind low back pain. In addition, when the arthritis becomes severe, compression of the nerve roots may begin, and that may develop into lower extremity pain. When you describe your vertebrae as being out of place, it's difficult to say without an X-ray or an MRI, but those are oftentimes the 2 etiologies that are causing these different areas of pain. Depending on the treatments that you've had previously, you could see someone like Dr. Pavlovich, who could attack the problem from a pain management standpoint, including possible